Good evening. I'm Rachel Sachs, Senior Director of Education and Outreach at the Cancer Support Community. Welcome to our live webinar today on World Mental Health Day. For those of you joining us for the first time, let me tell you a little bit about the Cancer Support Community. For more than 40 years, we at the Cancer Support Community have been a relentless ally for anyone impacted by cancer. We help individuals manage the realities of this disruptive disease and get back to normal. Whether accessing our free services in person at one of our 190 locations, online, or via our toll-free helpline, you're getting a team of licensed professionals providing patient navigation, financial counseling, genetic counseling, pediatric support, and more. Today, we're going to discuss mental health and cancer. Some people may think that mental health is a taboo topic, that mental health challenges are a sign of personal weakness, or that mental health is not important for your overall health. This is simply not the case. We are here today to better understand mental health, what it is, and why it's an important part of your overall health after a cancer diagnosis and in general. We will also discuss how you can speak to your care team about mental health concerns and additional supportive resources. We understand that mental health can be a sensitive topic. We acknowledge that everyone here comes with unique experiences, and some topics discussed today, including but not limited to suicide, may be triggering for you. Please take any steps that you need to support yourself and your emotional safety and comfort. I'm extremely grateful to have with us today an expert who will help us understand the many complexities and myths about mental health and also shed light on support options and resources for everyone. We are joined today by Dr. Brandon Knettel. Dr. Knettel is a licensed psychologist and assistant professor at Duke University School of Nursing and Duke Global Health Institute, and he's an associate director of the Duke Global Health Mental Health Program. His areas of specialization are global mental health and health behavior, with a focus on care engagement, stigma reduction, and mental health support for people living with chronic illness. Welcome, Dr. Knettel. It's great to see you.
Rachel, I'm excited and grateful to be here.
We're grateful for the support of Merck and AstraZeneca and partnership with the National Alliance on Mental Health Illness, also known as NAMI, and bringing you this webinar about mental health and cancer. Dr. Knettel, I have some questions for you first, and then we'll take questions from our live audience afterwards, if that sounds good to you.
Sounds great.
Great. Can you start off by explaining to us what mental health is and why it's an important part of everyone's health?
Sure. So yeah, some people will say you're maybe more used to hearing the term mental illness, and nowadays we're saying mental health much more often. And that's an expression right there in the words that we're talking more about the full spectrum of people's emotional health. And this is something that relates to everybody. In the past, we might have really been thinking about a small segment of the population who are really struggling or really experiencing serious symptoms. And nowadays, when we talk about mental health, we're really talking about something that affects everybody and your emotional well-being, all the way from kind of early prevention of mental health challenges, all the way to treatment of people who are really struggling.
Great. So two of the most common mental health challenges that we hear about in our society are anxiety and depression. Can you explain to our viewers the differences between anxiety and depression, what the characteristics are of each?
Sure. So anxiety is something that's marked by persistent worry or a sense of kind of agitation that comes from persistent worry. Whereas depression is more of a sense of lowered mood or lack of energy. And so some people view them on opposite ends of a spectrum, but really, honestly, you can experience both. You can experience persistent and consistent worry in your daily life in a way that's troubling to you. And you can have feelings of sadness, hopelessness, and low energy that happen at different points. And so depression and anxiety are the two most common kind of symptom sets. And symptoms is a medicalized term, but here again, it's something that I think we all can relate to. Everybody has experienced at some point in their lives. And when we talk about cancer, of course, some sense of worry and even anxiety, or some sense of sadness, even to the level of feeling depressed, is actually quite normal, both for somebody living with cancer, navigating cancer care, or loved ones and caretakers. So we are really trying to go away from that kind of pathologizing language for the typical person who's experiencing symptoms of depression or anxiety, while at the same time recognizing that some people do experience these things to the level where it does become a persistent challenge that requires some outside support. And so we kind of find that line between acknowledging it's something that we all experience at different times throughout our lives, while also recognizing that for some folks it does become more serious to the point where outside help is really a good idea.
Great. And we'll get to when you think outside help is warranted. So thank you for that. Can
Mhm.
you explain maybe some other common mental health challenges people may experience? We heard anxiety and depression, but some other common things that people might experience day to day.
Yeah, another one is often related to responses to trauma that people experience in their daily lives, or in isolated incidents throughout your life. An experience that really you have trouble coping with or getting over, that comes back in vivid memories or nightmares or intrusive thoughts. So trauma is another common experience that people have. There are more serious symptoms of mental health challenges where people struggle with things like delusions or even hallucinations. And I think often that's maybe historically maybe the first place people would think when they heard mental illness was somebody with schizophrenia who might be talking to themselves or seeing things that aren't there. And it's a very real challenge, but now I think we understand mental health to be a much broader variety of challenges. There are people who have fears, worries, anxieties about all sorts of things that can rise to the level of mental health challenges. And then also people who struggle with mental health challenges just in their day-to-day stressors, that it's not necessarily a standalone disorder or something they've been dealing with their whole lives, but where the circumstances of their current situation or lives kind of come together in a way that makes them experience a lot of distress around their emotional health.
Well, this is a great segue into the difference between stress and distress. So I'll say that again, stress and distress. And often in the cancer world specifically, there is something called distress screening, which if there's viewers on here who have been getting treatment in an infusion suites, they'll know that they've gotten distress screening. So if you can tell us a little bit about the difference between the two and how we can recognize when we have concerns with our mental health that might reach the level of distress where we should seek outside support.
Right. So stress is something that we all live with and experience every day. It's the challenges in your life, broadly defined, of anything in your daily life that brings challenge, that kind of stresses your coping skills and weighs on you at the end of the day. All the little things that we face to kind of get by and live our normal lives. Now, distress is when those things start to accumulate in a way where we're not functioning up to our full ability. And so where we start to experience that emotional burden in a way that impacts our ability to work, to go to school, to thrive in our social relationships and our family relationships, where it starts to really impact us in other ways, where your emotional health starts to make it difficult for you to kind of do the day-to-day things that you really want to do. And that's what we're talking about when we get to the level of distress. And that's kind of the first indicator that you might need to look outside of yourself, and that those kind of natural coping strategies that we all have and all have learned and all kind of employ on a day-to-day basis to get by and deal with normal stress, when those start to break down and don't work quite as well, and we need some more strategies, that's a sign that you're experiencing some distress and something a little bigger than your normal typical stress. So and when we talk about cancer, it's a enormous stressor, and one that is going to bring stress to you, bring stress to your loved ones regardless. Now, whether it's something that's bringing distress really depends on a lot of things. It depends on the prognosis, the type of cancer you're dealing with, the messages you're getting from your doctors, the coping, the social support you have around you, the skills that you have. And so there are a lot of things that can influence whether you're able to kind of take that in stride and continue to function and get by. But we expect everybody to take some sort of hit, to their level of emotional well-being when they get a cancer diagnosis or a loved one gets it. And so it's a question for each person of how much outside support they feel like they need to deal with that stressor.
And I would imagine, as somebody who's an oncology social worker and work with a lot of patients, one's level of distress can vary. You can have a different level of distress in the beginning of treatment versus mid and during survivorship. And I think it's just important for our viewers to know that it's really important to talk to your healthcare team about how you're feeling, to rate your level of distress, and that there are resources and supports out there for you.
Couldn't agree more. Cancer encompasses a lot of things, right? There are so many types of cancers, and each cancer brings with it its own challenges, whether that might be the potential for loss of life or long-term disability, or affecting your physical appearance, affecting your energy, having side effects of treatment. And then, similarly, it has similar burdens on the family, and your point about different phases of the process, from just starting to experience symptoms all the way through treatment, and even into remission. We talk a lot about the kind of ongoing emotional distress that people with a cancer diagnosis experience even years after they've been in remission. And so that process is different for everybody. And so yeah, that's a really, really important point.
And I think that's a really great point. And then I'll move on to our next topic, but that sometimes you're in this fight and flight mode during it, and you're just powering away. And then sometimes you don't feel these things, or have the ability to even wrap your head around it in terms of, like you said, in terms of you're in that remission stage.
Right. Yeah. And similar to grieving, right? Like I've heard a lot of people who've lost somebody or been in a situation of grief and said, like, in the moment, all I was dealing with were the logistics of that moment. And it wasn't until weeks or months later that it really hit me, and I really had time to emotionally process. That can be true of our own emotional experiences too, that when something the initial news hits, you go into survival mode and you do what you need to do to get by. And then days, weeks, or months later is when you really start to feel the emotional weight of that news. And I think that's totally normal.
That's right. So unfortunately, Dr. Knettel, as you know, there's some stigma surrounding mental health and mental health treatment. Stigma, just for our viewers to understand what that is a set of negative and unfair beliefs that a society or group of people have about something. Can you explain to us, when discussing mental health, why it's often stigmatized, and does the stigmatization exist more in some communities than others?
Sure. So I do a lot of work in other countries as well. And in other countries, when we would talk about mental illness, places where maybe the idea of mental health challenges were less familiar to the average person, they would often equate mental health challenges to schizophrenia right away, to somebody who's psychotic, who's talking to themselves, who's seeing things that aren't there. And the media portrayal of even people with those symptoms is often that they're dangerous, they're unpredictable. Well, first of all, the research shows that a person with schizophrenia is no more likely than anybody else to commit a violent crime. So that's just erroneous, and often just something that comes from media portrayal. But also that now, as I kind of started with, mental health challenges are a wide array of things that really influence everybody. It's not just that small subset of people with very serious mental health challenges. And so I think we're really breaking down a history where people thought of mental health as one very specific thing. And now as we're trying to kind of go back and say, no, this is something that matters to everybody, that influences everybody, that impacts everybody, we're having to break down some of that historical view. And yeah, some of it does come from the way it was portrayed in media and in our culture of the locked psychiatric unit at a hospital, one flew over the cuckoo's nest or something like this, where I think now we fully understand that's just a small picture of what we really mean when we're talking about mental health. So stigma, and then it also comes from the fact that mental illness, mental health challenges are often portrayed as something that's within your control or a personal choice, even when it's not. And I think, substance use being a perfect example, when we look at all of the different mental health challenges and we put them on a list of what has the strongest genetic component to what has the lowest. So the thing that if your parents and grandparents had it, you are also very likely to have it. Most people think that substance use would be way on the personal choice end of that spectrum. It doesn't really have anything to do with your genetics or your family history, when in fact we find that it has one of the strongest genetic components to it. And so it really is something that you're hardwired to struggle with. And so one person who uses alcohol in their teenage years and then tries to kind of taper back that use versus another person, they're completely have a different hardwiring that predisposes one person to struggle with it throughout their life and the other person not. And so by kind of understanding that this is not nearly as much personal choice as we've historically thought it is, it's something that is in some ways just something we're born with, and that we need to, if we're born with a certain set of predisposition to something, that we just need to seek out additional support to get by it, I think can help us to break down some of that stigma where we might blame somebody for something and treat it as something they've caused when in fact it's not. And of course, different from other types of health challenges, we can take a test for COVID, we can take a test for TB and we can see that we have it. Whereas mental health is not quite the same way. And so without kind of that, and then we can take a medicine or wait it out or get healthcare and then it's gone. Whereas mental health is not always that way. That it often takes, it's not as easy to see, and it's not as easy to kind of just treat and go away forever. That it creates this perception that maybe it has to do with choice when oftentimes it doesn't.
You're 100% right. I think that people sometimes feel with mental health that it's in our control, or somebody will say to you, well, go out and exercise or go take a break and go do this and you'll be just fine. And that's not the case. And I think we have to really be empathetic and sympathetic. Like you said, that there's a predisposition, and just like anything or any disease, we need to seek help, and that's 1,000,000% okay. So when speaking about mental health, it's really important to also discuss suicidality, which I know sometimes makes people uncomfortable, but I want to address that with you today. Could you please explain what it is and what some signs of that are, and when somebody should really consider seeking help?
Yeah, so suicidality is when any type of emotional distress, not just depression, but any type of emotional distress reaches to a level where a person's starting to have thoughts of ending their life, of killing themselves. And it's not just people who've had a lifelong history of depression. This can happen among anybody who kind of reaches a point where their emotional distress reaches that level of thinking about killing themselves. And the number one piece of advice that I tell anybody who's has experienced thoughts of suicide is try to find one supportive person, at least one supportive person in your life to tell about it. And even if you're not experiencing those thoughts right now, it's something you've experienced in the past, that can actually be a better time to initiate that conversation, because you can tell somebody, listen, this is something I've been through, that I've experienced in the past. It just felt important for one other person to know. And by having that conversation, it takes away one of the layers from between you and asking for help if you really need it in that moment when you really do need support. And so I think that is really crucial. And I think when I say that, sometimes people are like, well, who, my partner or a parent or or a sibling? And that's really daunting. That's really scary. And it's like, well, it doesn't have to be everybody. And it doesn't have to be even the person closest to you. Just one trusted other person can really make the difference of having somebody who knows. Really that sense that you're not alone. And I think for far too long, we haven't acknowledged how many people have these kinds of thoughts. In some of the work that we do, we see double digits, of people who are experiencing suicidal thinking, 10-15% of people, especially people who are experiencing a serious health challenge or a chronic illness. And so it is very, very common, and it's even more common among people who are having a really hard time with their health or with other things in their lives. So sometimes by talking about it with one other person, you start to see that you're not alone in these types of thoughts or these types of struggles. And as I said, it makes it easier to reach out for support when you are really struggling.
And I just want to mention some resources that are available. There's the 988 Suicide and Crisis Lifeline, that if you're in emotional distress, or for those who are in a suicidal crisis, to call, and it's available 24 hours a day. And also, you can always call 911. And also go to your local emergency room, where often there's a crisis center there as well. So there's support out there. People want to hear from you, and everybody wants to make sure that anybody that feels that they're in any level of crisis, that there's support out there for them, and somebody that's going to listen and offer a helping hand and an ear.
Yeah, and I've
So-
talked to people who've used 988 firsthand, and it has been a true lifesaver for people. And so I would certainly encourage anybody who's struggling with thoughts of suicide, other mental health crises, to try it, to use it. They're available by phone, but also they have a chat line and a website, a live chat. So, and you can text 988 as well. So all really important resources for anybody who's struggling.
Perfect. So, who are the healthcare professionals that should be considered when looking to talk about mental health and support resources?
Mhm. So within cancer care, most cancer treatment nowadays has really grown in this area of having a social worker on staff, certainly, and that would be a great person to talk to, but also having support groups available, either at that facility or being able to link you to those sorts of support groups, and also a list of mental health providers who are familiar with people living who are experiencing or going through cancer, and their loved ones. And I think that is important. I think most mental health professionals feel well equipped to work with people who are experiencing a serious health challenge, but those people who have specific experience of people going through cancer treatment can have that little extra layer of perspective and experience that I think is really important. But truly, I think most people on your healthcare team in this day and age should be well versed and well equipped to listen to your story in a compassionate way and to connect you with the resources you need. If you try and the first person maybe doesn't seem to be the right person, doesn't seem to understand the topic, doesn't have connection to the resources, they will probably know who does. And so I think this is an area where cancer care has just come a long way. In fact, when we talk about mental health in the context of other health challenges like HIV or other serious health challenges now, we often use cancer as the exemplar, the area of healthcare where we're doing this well and attending to people's mental health really well. So if you're concerned about your provider stigmatizing you or not understanding, I think that's just often not the case. And I think your whole cancer team will be really compassionate and ready to hear about these sorts of things, especially if it's something that's impacting your ability to go through cancer treatment. If you find that your mental health is affecting your ability to go to your appointments or take your medicine, absolutely, that's very relevant for your cancer team so that they can make sure that they're supporting your mental well-being, because it really is relevant to your cancer treatment and your cancer outcomes.
And the care team doesn't know what they don't know. So it's really important to share that information, to share information if you're already on medications, because of how that could potentially influence your treatment. And like you said, Dr. Knettel, if you've reached out to the first person and you're not really comfortable or didn't feel that the response was appropriate, there's so many other people on the care team and so many resources available, and people that really truly want to help, like nurse navigators, your physicians, social workers, et cetera.
I agree 100%.
Are mental health resources covered by insurance?
Yeah, so now there is a requirement for health insurance to cover mental health. Now, the extent to which they cover it varies quite a lot by your healthcare, your health insurance. And so they may limit the number of sessions, you may have co-pays or deductibles, but it is required that each health insurance policy does have a mental health, behavioral health component. And so I think that is always a great place to start, is to see what coverage your health insurance does have. And to kind of understand whether it needs to be somebody in network, whether are these copays and deductibles, because yeah, you don't want to get a surprise bill.
Mhm.
But this is also something that mental health providers deal with every day. And so they know exactly which networks, which healthcare or health insurance providers they are in network for. There's also a common strategy where they may not be in network, but they will either provide and submit the paperwork to your health insurance for you, or they will give you a form that you can submit to your health insurance for you to submit it directly. And so again, this is something healthcare providers, mental health providers are dealing with almost every person they see every day. And so they will know exactly, based on your health insurance, what they can provide, whether they're in network or out of network. And like I said, either submit the paperwork themselves or help you to do so you can get reimbursed if possible. Another thing, even if they don't take your particular insurance, is some mental health providers will offer therapy on a sliding scale. And so depending on your income and your ability to pay, they'll often lower the fee to make it more affordable if you're somebody who's going to have a little harder time affording the full cost of therapy or treatment.
I would also say that often certain cancer centers might have a special fund that you can seek help from the social worker, that should you not be able to pay or pay the full amount, can help supplement that as well.
Yeah, absolutely. And that all of what I was talking about tends to be more related to the individual
That's right.
counseling in psychiatry, and support groups are often offered free of charge. And that's
That's
a
right.
really important resource too. So often the cancer center itself will have support groups that are kind of drop in as you wish, come whenever you want, come to as many sessions as you want, and that's all usually offered free of charge too.
Can you talk a little bit about, since COVID happened, everything went virtual. And I think for certain things, particularly like therapy, some patients, particularly cancer patients who are immunocompromised, et cetera, some want to go back in person to meet with the provider, but some want to go virtual still. And if you can tell us maybe your thoughts on the benefits, or if it's not beneficial.
Sure, I think it's really personal preference, honestly, for both the patient and the provider. Psychologists, therapists, psychiatrists, we were some of the kind of sticklers on, well, if I'm not in person, like, how am I really going to connect with somebody? I won't be able to see their body language, and it'll be harder to tell their facial expression. I won't feel as personally connected. And that was true right up until COVID. And then we were all kind of thrown into this world. And I think all of us came to realize like it is very possible to make a meaningful connection to somebody over video or even over the phone in ways that we never would have imagined. And we're probably hesitant to even try. And so I can certainly say that I feel good and confident, both as somebody who seeks counseling myself and when I'm providing counseling, of doing that over video. But I also understand that some people still have that preference and feel better and more comfortable when they get to see somebody face to face. And some providers still feel that way too. And so if somebody doesn't offer in-person sessions and that's your preference, they might know somebody who does, or you can try to find somebody else who does. A lot of therapists will offer both nowadays. It come either, they'll have some days maybe where they're working from home and some days where they're in the office, or virtual versus in the office. And some have gone fully online, some have kind of really emphasized going back in person. And it's just personal preference, I think, on both sides, the provider and the patients.
And similar with support groups, in person versus virtual. And it really, like you said, Dr. Knettel, is dependent upon what feels right for you and what works for you. And that might change. You might want in person, and then you might have, been going through something both either emotionally or physically, or some type of treatment, and want to, change to virtual. And that's okay too.
Yeah, and I will say along with that, COVID led to a loosening of restrictions around this. It used to be that us as therapists could only practice, could only remotely see people who were located in states where we were licensed. And so I'm licensed in the state of North Carolina. I could, even if I was doing work virtually, could only see people who were currently located in the state of North Carolina. And it was a little bit silly and arbitrary, honestly, because if somebody's 5 hours away in Western North Carolina versus across the border in Tennessee, does that really make a big difference in terms of me being able to provide support for them? And we've reduced those restrictions now. And so I have a friend, for example, who has a therapist in California, and she's here in North Carolina, and they've seen each other remotely since the beginning of COVID. And then every few months, she'll actually go out and fly and have a session in person because
Oh,
she
wow.
just likes having that in-person connection. And I know people who, even if their therapist is right down the street, will primarily do it remotely for convenience, and then occasionally maybe do that in-person session just to get a sense of connection and a little FaceTime with their therapist. And so those kind of hybrid arrangements have become more common and work really well too.
That's great information. What would you advise someone to do if they don't feel comfortable talking with their care team about their mental health?
Mhm. Yeah, if not with your care team, then somebody, right? And it's really comes back to you and what your level of comfort. And I think finding either somebody in your personal life or a professional to talk to, even just one person, can make a big difference. And this isn't just in a, advice giving way. You might feel like you really have your head wrapped around exactly what you're experiencing, but sometimes just talking to another person brings some of the weight of just holding something and having all of that weight on your own shoulders. And then another times you'll just find that another perspective, it brings something that you had never imagined. And that was maybe a humbling experience for me as a therapist of, I've spent years of my life training to do this and providing guidance to others. And then as a client, as somebody seeking counseling myself, every session I'm struck by something that I just had not even considered and not even thought of. There's no other relationship in your life that is 100% about you.
Mm.
None of your personal relationships, family, partner, kids, right, are about you. It's a give and take. And a
Mhm.
therapist, that is what we signed up for. That is our job, is to help you and support you. And that's a unique relationship that you won't find anywhere else. And I guarantee for folks who haven't tried it, that it's a pretty remarkable experience to have somebody who's just fully invested in your well-being.
I love that, Dr. Knettel. That's really great. Um, so caregiving and being a caregiver with somebody who has chronic illness, particularly cancer, can be really taxing, as you know. Can you take a few moments to discuss why loved ones or caregivers should also really focus on their mental health and wellness?
Yeah, it's similar to what we talked about with a patient, and in that you are faced with a emotionally overwhelming situation, but also logistically overwhelming. Um, Lots of appointments, a lot of arrangements, a lot of treatments to navigate and things to consider. And it can be, I think, in some ways comforting to really hone in on those logistical things and really say, like, I'm going to help get things done and take care of the business side of this and make sure that we get the treatment we need and that things move forward. And the emotional side can really get neglected. But thinking about a person we love and care about struggling and facing, a potentially life-threatening illness is terrifying and has so much emotional weight attached to it that it is important to acknowledge that and to reach out for support for that. It's really critical. So earlier when we talked about the support groups that are available, often, almost always, those are available to patients, and very often they're available to caregivers and family members too, free of charge as well. And so be on the lookout at the Cancer Center, or ask your care team about support groups for caregivers and family members, and those are really often available. Or individual counseling is really just as applicable for loved ones as it is for the person themselves.
Perfect. Can you briefly discuss, and you've kind of waited on this a bit. So there's individual therapy, group therapy, support groups, and other therapeutic options. How do you determine what's the best option for you?
Yeah, to kind of round that out, we didn't talk as much about psychiatry and medication options, which I think are important to acknowledge too. So there, if we look at the evidence, right, of what works for people experiencing depression or anxiety or most mental health challenges, we'll typically find that studies about therapy alone show that it's beneficial. It's absolutely beneficial. Studies about medication alone show that it's beneficial. It had to be, or else it would have never gotten approved for the use that it's there for. But when you put them together, not only do you kind of lump those two benefits together, you see kind of an increased benefit that each of them contributes to the other doing even more. And that's really important to say. So if somebody is really struggling, if you're seeing a counselor, to talk about medication as a potential option. Of course, there's a lot that goes into the decision of whether to take medicines for mental health or not, just like any other medicine, of whether there are side effects or cost issues or any other reason why you might not feel comfortable going that route, but it is an important one to consider. So yeah, so individual therapy, group therapy, talking to a social worker, potentially seeing a psychiatrist or who can prescribe medications for mental health challenges are all kind of treatment options that are available. There are also more complementary therapies that are really important
Mhm.
too. Things like, massage, nutrition, acupuncture, these kind of allied health professionals that we might not see as directly relevant to mental health, but are certainly a part of the picture of cancer care nowadays. And so we see a more integrative approach, a kind of whole health or whole person approach to healthcare. And that's very true of mental health too, that when we're taking care of the other aspects of our health and well-being, we find that it has a real benefit on mental health. So it all kind of relates together, that if you can improve your health, functioning, well-being in one area, it's going to have effects on all the other areas of your health too.
I love that you said that we had to focus on the emotional and the physical, and in coordination with that, the complementary services, that integrated medicine piece, the exercise and the Reiki and what have you. And a lot of cancer centers have that, or offsite centers, or cancer support communities, your local ones, they have those services. So those are really great and unique services to help with mental health and mental well-being, both for patients and caregivers. Um, and in terms of medications, thank you for bringing that up. And what I would just say to our audience is that if you do go on a medication, or if you had been on a medication, really critical to bring that up to your care team.
Right, yeah. So with any two medications, your providers are always going to look at whether those medicines might have an effect on each other, whether they'll interact in some way that might actually make one function differently or less effectively. And so that's really important to make sure that all of your providers know your full list of medications at any time. And the same with discontinuing medications. If you
Mhm.
decide that something's not right for you, don't just stop taking it. Make sure that your whole care team knows that and is on board so they can be up to date on your medication list.
That's right, because sometimes they'll advise you not to stop it immediately, but that there's a regimen in terms of how you might want to discontinue it. Okay. What are some of the other challenges, Dr. Ken Knettel, that you've observed or concerns that have been shared with you, particularly when somebody's working, when somebody has a mental health concern and is dealing with cancer?
Right. So, as I said earlier, cancer is just such, encompasses so many different things, and different types of cancer, different severities of cancer, different stages of diagnosis through treatment through remission, that it really does cover a wide range. And so, just like any other mental health counseling, I think it's kind of being prepared to tell your story. And that's something that I think we all, think about in advance of a first session of what am I going to say to somebody. And so it doesn't have to be your full life story, but really coming prepared to talk about kind of where you're at and what's contributing to your feelings of stress and distress today, and that's what can help you be most helpful. um, Really, I think most of what people think of when they think of counseling in the context of cancer is that everybody's going to be fixated on illness and the potential to die, and of
Mm.
course that's important, um, but more but cancer treatment is much more than that. It's continuing to maintain your relationships, maybe continuing to function at work or in other areas of your life that are important to you as you navigate cancer treatment, and all of the little logistical things in your life that don't go away once you start cancer treatment.
Mhm.
Um, we would, in some of my conversations with people with cancer about, what's your daily, what was your biggest stressor today? People be like, parking to get to the clinic today, right?
Yeah,
And like that matters, right? Like the
that's
things that
right.
look stressful, those little things, they don't go away just
Or
because
the
we're
traffic
fixing
that they
it.
experienced.
Exactly, right? And so it's just another big thing on top of all of the other big things that we all face on any given day. And so cancer does not have to take over your counseling. It doesn't have to be the only thing you talk about. And I think any good therapist will understand that it's one of many things that you think about and deal with on a daily basis. And you're certainly welcome to talk about all of those aspects of your life, things that happened before, during, and after you found out you had cancer, and that's totally normal and appropriate.
Okay. So if somebody has a pre-existing mental health condition, they've already had depression or anxiety or a suicide attempt, what would you recommend to a patient in terms of what the best way to deal with this is alongside a cancer diagnosis?
Yeah, people who've been dealing with these things for a long time, sometimes their whole lives, come to understand what are the things that make it worse, that lead to more distress or more challenges for them, and have developed personal coping strategies, ways to get through those difficult times. And for them, I think it's just understanding and knowing that cancer is a great big stressor that's getting thrown in amongst, those other things that have led to challenges throughout your life. And so in some ways, those folks, might already have developed a lot of coping strategies for dealing with these things, but not one like this. And so it's a new stressor, and it's a big stressor, and it's something that they're going to have to take in stride. And so even if you haven't gone to counseling recently or feel like you have medications that have generally worked, you might need to revisit that, in the face of this new really big stressor. And so that's something to consider. But yeah, in terms of communication, I think just letting your team know, your cancer team know that that's something you've dealt with throughout your life, even if it hasn't if cancer hasn't caused it to reemerge yet, or doesn't feel like it is causing it to reemerge, just letting your team know so they have the heads up to be on the lookout and to help you to be aware of that if it does start to crop back up. I think it is really important.
Great, great advice. Can you just discuss, in closing, we're about to close on our set questions, what people can do on a daily basis to support their mental health and mental well-being?
Mhm. Yeah, so earlier, we said you don't want to use, lifestyle as a way to explain away a mental health challenge. You don't want to say, oh, just exercise and get a good meal and a good night's sleep and it'll be fine, because that's
Mhm.
not entirely true. But I do want to make a pitch that those are things that are well within our control that can be really beneficial. And so if you do take care of your physical health and well-being, and those are kind of the main categories of sleep, diet, exercise, substances, limiting the alcohol, drugs, caffeine, those are all things that are very within your control that you can do today that will have a noticeable benefit on your mental well-being. So start there, but don't end there, is my advice.
Mhm.
Taking care of those things that are well within your control are really important. And then the next thing is to find somebody to talk to. And if seeking a professional right now doesn't feel like the right choice for you, feels too overwhelming, then find somebody in your personal life, or try 988, an anonymous helpline, something like that, where just one other person, it can be really life-changing to just get that weight off your shoulders and share with at least one other person what you're going through. And then there are a ton of great resources online or in books to understand the experiences of other people who've experienced mental health challenges, or resources, guidance, advice for how to deal with these things, and just kind of take it as a self-study, just as people often do with their cancer care. We all kind of often feel compelled to learn about the things that we're going through as a way to cope with them. And I think mental health is no different. Learn about it, learn about what's been helpful for other people. And I think you'll find that a lot of those same things are helpful for you.
That's great advice. And to what you said, about the importance of exercise and nutrition and helping one's wellness, sometimes weight is a struggle, particularly if you are going through treatment, weight loss, weight gain. So that there's physical therapists out there, there's exercise programs out there that are specifically geared for cancer patients, and also dietitians and oncology nutritionists, who can really help support you with those important strategies while you're getting treatment.
And cancer treatment is tough. I mean, we are meant to believe that medicine makes us feel better. And
Mhm.
in the case of cancer treatment, radiation, chemo, sometimes it makes us feel worse. A lot of times it makes us feel worse before it feels better. And I think we can be really thankful that treatment has come a long way, and that providers are much better at and treatments are much better than they were in the past, and the side effect profiles aren't as bad as they were in the past. But we have to acknowledge that people will sometimes lose appetite, lose sense of taste, feel exhausted, feel nauseous, these things that make it hard to prioritize those exact same things that I was talking, make it hard to sleep, right? Those exact same things that I was saying that we should be emphasizing. Your treatment might make it really difficult to do those and prioritize those. And so I think it is also about setting realistic expectations for those things based on where your physical health is today, and knowing that that might change throughout the course of treatment. That when you're in the midst of a strong, in the midst of treatment, it just might not be realistic to exercise as much as you want,
Mhm.
or manage your nutrition or your sleep in the way that you want to. But being prepared to kind of take advantage of where your body is at any given day, and do those things as best as you can.
That's right. So now's a great time for our audience to drop any questions you might have into the Q&A tool. But before we open it up the forum for questions, I have one more question, Dr. Knettel, and it's been really wonderful speaking with you. What else do you want to make sure our viewers know about mental health before we finish this webinar?
I think the most important thing is just knowing that I think giving counseling a try. Really, I think that's where it comes from. That there are so many people who come into counseling, and even after one session, their response is, "This is not what I expected." And sometimes that's in a surprising way, an overwhelmed way, but most often in a good way. And that it wasn't that they expected, but that it was very beneficial. I know a lot of people who gone to counseling for years and see it as a really vital part of their lives. I know other people who go occasionally as kind of a top up, but a lot of people who end up giving it a fair shot really just do find it beneficial. And so I would say, don't knock it till you try it, maybe is the statement here. If you've never gone to a counseling session, give it a shot, 1 or 2 sessions, especially if you're somebody who's really struggling with your emotional health, and let the experience decide whether it's something that's for you without letting your preconceptions make that decision for you.
That's perfect. And I think, like you said earlier, try individual. If that doesn't work, maybe a support group works. But there's various modalities and support resources out there for you. And if that type of counseling doesn't work, we have tons of resources. There's tons of resources out there, tons on our CSC website to help you both as a caregiver and as a patient. So let me open up the Q&A and ask you a few questions that came from our audience. Do you have any suggestions, Dr. Knettel, for a caregiver who's caring for someone who will not seek professional help with their depression?
Yeah, this is a tough situation. And I think some of it is sharing some of the things that I shared today of really just trying to help the person to understand that it's something for everybody, that it's not something that is only for people who are unwell or sick, broken, right? Like these are misconceptions, that it's something for everybody. And maybe even the message that, how about 3 sessions? How about a couple of sessions? Just give it a shot, see if it's something that's for you. And if you give it a fair chance and decide it's not for you, I'll understand. I think that is a nice message too. It's not something you're signing up for years, but give it a fair chance and then decide.
Okay, great. So I think you've addressed this, but I think it's still an important question to ask. Somebody's asking again, how and when should I talk to my care team about my mental health? And I think that we've talked about this a bit, about it's really important to address it from the beginning.
Yeah, and most cancer patients that I know have that person on their care team who's kind of their person. And it's maybe a nurse or maybe a doc who you just connected with personally, and that's your go-to, and I think that is always a good person to start. If you have that person who has been really supportive and caring for you, you've kind of already established that relationship, a sense of trust to that person. And I promise you're not the first person who's brought that up with them, probably not the first person that day or that week. And so in most cases, they're going to respond really compassionately and have some helpful advice or a resource for you. So yeah, find somebody who you feel is the right person and a trusting person, and just go for it. And I think you'll find that that it's a weight off your shoulders. Something I always say to anybody who's struggling to talk to their loved ones about mental health is, imagine somebody you loved and they're struggling with something in silence. Would you rather that they continue to hold that burden themselves and keep it in every day, or would you rather they tell you? And almost inevitably, of course I want them to tell me. I would love to support somebody through anything if it's somebody I care about. And then, okay, are you giving the people around you, the people in your life, that same choice? And oh, maybe I'm not. And so give the people that love you the chance to support you in the way that they want to.
Perfect. Somebody dropped a question that they'd be interested in learning where they could find physical therapists specifically dealing with cancer patients. professional organizations. What I would say, and let me know what you think, Dr. Knettel, is to definitely talk to your healthcare team. That often, whether it's a infusion center that's not connected with the hospital, they'll have resources about outside services. And then often if it's connected with a hospital, there's physical therapists often within the PT department and OT who specialize in working with oncology patients.
Yeah, I completely agree with that. It really depends on where you're getting your cancer treatment. A big cancer center might have different resources from a smaller hospital. And so it's really, that tends to be a lot of the resources we've talked about today can be specific to the place where you're seeking care. And so your local providers are going to be the ones who know the best what's available at that place, or whether you might need to go somewhere else for some of these more specialized things.
This is an interesting question. I really like it. So, as a counseling provider in the cancer community, do you have any insight or research to help guide when to do distress screenings and any tools you use different from the distress thermometer?
I actually really like the distress thermometer and I use it a lot because it doesn't use specific mental health terminology. And so it prevents that feeling of stigma that some people just naturally hear when they hear depression or anxiety or these words that we automatically link to mental health challenges. And so I think even when we do often ask, questions a question related to anxiety, a question related to depression, and then add on the distress thermometer, we'll get people to say, nope, no depression, no
That's
anxiety.
right.
And then what's your level of distress? 8 out of 10. And it's like, okay, something's going on.
That's right.
And so I really do like the distress thermometer actually. And I think when to use it is universally. I think as in every appointment, I think that's a question, and it takes 5 seconds to ask that question. So I think that distress question should be asked in every appointment, at least at one time in every appointment for cancer. And then if somebody ranks something, let's say 6 out of 10 or higher, then you might ask some follow-up questions about, okay, what's contributing to that distress? And I think there again, leave it in an open-ended way. What might be contributing to that 6 out of 10 or 8 out of 10? And it might be depression or anxiety, it might be parking, it might be traffic, right? And those, whatever it is, it's important because it's led to somebody to feel like their current level of coping isn't keeping up to the level of stress that they're experiencing. And so then you ask the follow-up questions to kind of understand what's contributing to that level of distress.
That's right. And I would just add that, whether this person is an oncology social worker, there's always AOSW, there's NASW, there's other counseling provider organizations. So talk to your colleagues about what they're doing, what's working. With the stress screening, you need to at least do it at one pivotal time. But like you said, Dr. Knettel, to really do it every single time takes a few minutes to really gauge where the patient is that day in that moment. One last question, and then we're going to end our session. This person indicated, my husband suffers from anxiety and agoraphobia. I was diagnosed with stage 4 brain cancer last year. My husband continues to insist he wants me to get well and support me, but I don't feel he does support me on a daily basis. He takes me to doctor's appointments, but won't ask me how I feel and if there's anything he can do to help me. Can I attribute this to his mental health?
Our mental health and our pre-existing mental health challenges can influence every aspect of our lives. And just like a new cancer diagnosis can lead to new distress for a person being diagnosed with cancer, it can do the same thing for your loved ones, that he may have found an equilibrium, a sense of balance with his mental health challenges until this big stressor came along, and this has thrown everything into chaos and kind of caused some of those things to come through. And he might be using a lot of his resources to deal with his own feelings and his own challenges. And that may be why he's not able to offer you the support that you really feel like you need in this moment. One type of treatment that we haven't mentioned is couples counseling. And that seems like that might be a good option too, of finding a way either in a personal conversation with him or in a couple session to let him know what kind of support you feel like you need beyond just driving to appointments. and seeing if maybe doing that with a counselor who kind of has both of your best interests at heart might lead to some balance of him being able to offer his perspective on why he hasn't been able to support you in the way that you want, and your feelings about how he hasn't been able to support you. And you might find that a conversation with a neutral third party can be really helpful.
Do we have time for one last question that just came in?
Very happy to.
Okay, great. What psychotherapy modalities or approaches from your experience work well with anxiety of recurrence that cancer survivors may experience? It's a great
Yeah,
question.
I'm gonna offer a unique perspective. Well, maybe not unique, but a different perspective on this, which is that when we look at the things that predict what makes counseling work, and we throw in all the different the ingredients into that recipe into research, and then we see what emerges as the thing that predicts good counseling the best, and improvement the best. Often the type of counseling isn't the thing that emerges as the number one predictor, meaning the theoretical approach. What often emerges is whether it's a therapist who can build a sense of trust, a good, strong relationship in counseling, and help you to feel hopeful about the future. And so rather than direct people towards a very specific type of counseling, often I say, try to find somebody who has a great reputation, who you meet with and feel a personal connection with, and where the counseling feels helpful to you and that you're able to build a trusting and strong relationship. There are specific treatments for specific things, but I think often that relationship with the therapist and somebody who can help you to feel trusting and build a strong therapeutic relationship is going to emerge as the thing that helps the most.
Perfect. So in closing, I want to mention our Cancer Support Community Helpline. That number is 888-793-9355. It's open Monday through Thursday, 11 a.m. to 8 p.m. Eastern Time, and Friday, 11 a.m. to 6 p.m. It's staffed by community navigators and resource specialists who have extensive experience in helping people affected by cancer. Dr. Knettel, thank you so much for joining us today. The information and insights you've shared with us are without a doubt invaluable to our listeners. Thank you again to our sponsors, Merck and AstraZeneca, and partner NAMI. It's been my pleasure to have you join us today for this great conversation.